One of the biggest concern that patients with depression have is that whether depression will ever get cured, will they ever recover from it? Let's talk about this topic in this video. I'm Dr. Praveen Tripathi. I'm a consultant psychiatrist and sexual disorder specialist. Now, please remember, the course of depression is different in different individuals. There are people who once develop symptoms do not recover ever. But these are a very small minority. It rarely happens. Then there are patients who develop depression and they recover within few weeks and they never develop another episode. Even these patients are very few. The data about recovery of depression is different from different sources. The reason being that the studies have been done in different countries, and at times these studies are not, the data is not concordant with each other. The data differs in different studies. I would be quoting the data from the DSM-5, which is primarily based on the studies done in the United States of America. Now, the data says that almost 40% of patients who develop depressive symptoms, they start recovering within 3 months. And as many as 80% patients start recovering within 1 year. So, which means that vast majority of patients do recover from depressive episode. And this viewpoint that many people have that once depression develops, it would stay with you forever is completely false. It's a blatantly wrong information. Now, many times patients come to my clinic and tell me that they went on Reddit and they went on Instagram or Facebook and they saw people over there saying that depression, you can never get out of depression, and that demotivates them a lot. Now, the reason is, say there are two people, there are two persons who develop depression at the same time. The first person recovered within 2-3 months and started going back to office, started living his normal life, got preoccupied with the day-to-day work, and this guy does not have any time to go on the depression forums and post anything about depression. On the other hand, say there's a second guy who unfortunately did not recover even after 1 year, 1.5 years or 2 years. He's still struggling with the symptoms. He's still not recovering completely. Now, this person who is in pain, who is struggling, who is suffering, he is more likely to go on to the online forums and discuss about his issues. Now, I'm not saying that people online are lying, but there is a representation bias. People who have recovered would not be there in those forums. People who have been struggling would be primarily there in those forums. So the reason why I'm telling you is that please do not get demotivated just by looking at the comments made by certain individuals on social media. One important point that you must remember is that as the duration of symptoms increases, so is the chances of recovery. The chances of recovery goes down with that. The longer is the duration of symptoms, the lesser are the chances of recovery. That is why everybody keeps on saying that if you're having depressive symptoms, please don't sit on them, go out, seek appointment from a psychiatrist or a clinical psychologist and start your treatment as soon as possible. Because the longer, the chronic are the symptoms, the more difficult it becomes to treat them. But that does not mean that if you're having symptoms for a long period of time or for years, you should get completely demotivated. It's not that you cannot recover now. Probably more efforts would be required, maybe medicines for longer duration would be required, more intensive therapy would be required, but there is hope for everybody. But if possible, we should minimize the duration between the development of symptoms and seeking of treatment. So basically, in the end, I just want to say that depression is something that can be cured. Recovery is definitely possible, and please don't get demotivated from all the information around. Sometimes it can be wrong, and go out and seek treatment for yourself.
अगर आपको डिप्रेशन की समस्या है तो आप डॉक्टर प्रवीण त्रिपाठी से सीख सकते हैं कि डिप्रेशन के पेशेंट्स में काउंसलिंग कैसे की जाती है और उन टेक्निक्स को यूज करके डिप्रेशन से बाहर निकलने की जर्नी को शुरू कर सकते हैं। स्क्रीन पर दिए कार्ड को क्लिक करें या फिर डिस्क्रिप्शन में दिए लिंक को क्लिक कर डॉक्टर प्रवीण त्रिपाठी के कोर्स में एनरोल करें।
Friends, we have been trying to create educational videos on the psychiatric disorders as well as sexual disorders, and if you like this kind of content, you can definitely join us. Thank you.